Greetings from our Middle Tennessee studio, and welcome to today's Vista Points podcast, Choose Your Path, where the Vista Points staff are committed to improving the quality of life for people of any age who are living with a physical, mental, or intellectual disability. I'm Bart, your podcast host. My role is to walk with you on this journey of discovering and using special needs trust. We continue our podcast this session with an interview of a couple of helpful professionals. We'll also give you stories about how people use their special needs trust, how it's impacted their lives. In case you're new to our podcast, I invite you to refer to the past episodes, which are found on Vista Points website and on YouTube. Recently, we've brought attention to the importance of health, especially through self-care and mental health. We focused on services and resources most often found outside the home. After today's podcast, hopefully each of us will be able to know how to obtain the services or resources we need. Each of these conversations recognize the value in paying attention to our overall health for ourselves and others, no matter who it is, what age someone is, or what phase in life they're in. Today, we're fortunate to interview Genell Holloway and Tim Fleschner, who are co-owners of MidSouth Home Helpers of Germantown in West Tennessee. We'll learn the goals, the details, and the steps of experience in non-medical health care in the home. Hello, Genell and Tim. Thanks for joining us today.
Excited to be part of the show today, Bart. Thank you.
Good morning. Glad to be here.
I understand you both have recently become the owners of MidSouth Home Helpers. Would you tell us what this organization is and the services it provides? What makes it stand out from the other home health companies?
Bart, that's a great question. Thank you for asking it. We are a premier non-medical in-home agency providing care wherever people call home. That could be in the home of many years or a facility. We help people who need assistance with their day-to-day living activities, whether it be for a short time while recovering from surgery or a long-term declining health situation. Some are living in the facility but need extra help. And of course, some have chosen to stay in their home, aging in place. And some may even be living with relatives who also need help with their parents' care or with the care of their loved ones. What differentiates us from other in-home care agencies are that we hire experienced caregivers. We require a fingerprint background check as well as drug testing as part of our caregiver onboarding process. And we do a home assessment to ensure that the home is safe for both the prospective client and our caregiver.
That's terrific. I appreciate that all these services are found in this one place. Now, for us to get to know each of you better, first, Genell, would you explain your title and what you do in your work? How did you become involved in Home Helpers?
But I have such a vast round of experience in the healthcare industry. My very first job was working as a nursing assistant in my little small town hospital. And I've been a caregiver both professionally and personally. And I love helping people. When the opportunity came up to be an owner of Home Helpers, it was just a natural fit to my personality and desire to help others. Now I get to help in a much broader way than I ever could individually. My role with Home Helpers is more geared toward the marketing side of our business.
That's great. Thanks, Genell. You're a wealth of information. Tim, would you explain your title and work and what led you in this direction?
Yeah, well, much like Genell, I was introduced into healthcare, but at a very young age. My mom was employed as an activities director in the nursing home in our small hometown in Illinois when I was just a young boy. In that, I remember being surrounded by elderly, and I remember being a part of activities that mom would facilitate to enrich the residents' lives through engaging them in fun activities. In regards to MidSouth Home Helpers, I am the managing partner. Basically, Genell is the boss lady. We refer to her as boss lady. She tells me what to do, and I just make sure it gets done. No, seriously. I've got a background in third-party logistics where I was responsible for day-to-day operations. And so in that, I'm bringing that expertise to MidSouth Home Helpers, where I work with a team daily to ensure that we're making sure that we get all the schedules that the clients are requesting, making sure they're filled with quality caregivers, ensuring that we adhere to all federal, state, and local regulations.
Both of you seem to offer a lot. During our podcast, I enjoy having our guests share stories with listening audience. Do you have a story related to the company that you can share with us?
Well, I'm usually not a storyteller, and we've only owned the business for a short period of time. But to kind of tell my story, it's been getting to know the established business. I mean, when you're taking over a business, you have to get to know the stakeholders, the clients, understanding the processes that have been in place, but then also looking at it of ways that we can make it better and provide even better quality care. So Genell and I both came into the business with the hopes of providing quality care for those in need while offering respite for primary caregivers or their family. Both of us have firsthand knowledge of what we need because we've been primary caregivers. Genell caring for her terminally ill husband until his passing, and then me caring for my mother. She's been with me since 2016. She struggles with onset dementia, and her cognitive skills have diminished over the years. So in regards to the business, in the short time frame that we've had ownership, we've experienced quite a few unexpected obstacles that just helping provide the care to our clients. But we've also been able to experience the inner joy of being able to provide quality service to our clients that we know gives them some respite, some time to just enjoy themselves. There's many stories we could share. Maybe Genell has a couple, but I've been kind of in the operations side of things and just trying to help us streamline things so we can provide better quality care.
That's interesting. It does bring up a couple questions in my mind. You care for children in addition to the adults? Do you provide 24-hour a day, 7-day a week care? What about the holidays? What other specifics do you provide that most people don't know or think to ask at first?
Yeah, those are all great questions. So currently we don't care for children, not that we couldn't. We do have one late teen, early 20s young man that we care for right now, but our business has mainly been geared towards the elderly or disabled. We do provide care 24/7 if that's what's needed by the families. We, again, offer assistance to all the family members caring for their loved ones, again, just for offering assistance in the responsibilities of care. We've basically stayed in the lane of elderly care, but we are looking to expand those services. We're recently looking to get certified with the Veterans Association so that we can provide care for them. We're also, as I mentioned, have a client that is on the autism spectrum, and he's, being able to provide care for him while his family gets a little bit of respite time. So we offer, again, availability. We're available to care for anyone that may need assistance in their day-to-day needs, from, again, individuals recovering from outpatient surgery to those aging in place.
That's great, Tim. I think you answered some of my questions before I even asked. Now, when I learned you'd be coming into the podcast, I immediately visited your website. I see your company likes to care for a client's loved one like they're part of the family, keeping them safe and independent. I think that's great. At Vista Points, many of our clients, who we call beneficiaries, request and or need non-medical home health. Will you explain the different tiers of service that you provide to people living with a chronic illness or a disability?
That's a great question, Bart. And home health is different from non-medical home care in that home health has licensed nurses on hand to perform those medical needed tasks, such as administering medications, IVs. They are restricted to only being able to certain tasks within a short time frame, such as they don't typically provide 24-hour care. Whereas in home care, it can cover a few hours each week to 24 hours a day. Our caregivers help with light housekeeping, laundry, bathing, meal preparation, getting dressed, transportation to activities or doctors, grocery shopping, and or taking the client personal shopping.
Wow, I think that covers all the gamuts. It seems like there's something for everyone. Janelle, do you have a story of one of your patients who lives with a disability?
Oh, yes, Bart. Each client had a story for sure. Life is never dull in the caregiving business. Our youngest client right now battles the challenges of autism. Our caregiver is able to engage with this client so they have built a meaningful rapport. The time we spend with him allowed his family to have a break and to go and do the things they need or want to do without concern for their autistic adult child. Another story I can tell you about is one of our clients who battled dementia. We were providing care a few hours each day until the family dynamic changed drastically in just a short period of time when the spouse passed away unexpectedly and the need changed to 24-hour care immediately. We were so happy that we could help out with this situation. One more story is about a couple who we were caring for where the gentleman had been the victim of a stroke. We were giving care a few days a week, a few hours each day, about 3 times a week. And when his spouse fell and broke her hip, the need for 24-hour care immediately went into effect. The spouse is now home, and as she improved, their need for 24-hour care is diminishing, and we're able to adjust to the family's needs as their needs change.
Janelle, that's great flexibility that you're showing. That's what I especially enjoy hearing about. All the good care you provide. In thinking about your services, Tim, what resources do you suggest for anyone to access, regardless of their location or yours?
Well, I mean, first and foremost, you should talk with your doctor, of course. And some other areas or agencies that could possibly help is the Area on Aging chapter, maybe for additional resources. I think they're in various areas. You have individuals like elder care consultants or estate planning attorneys. Any of those could, by all means, offer various resources in that. And then, of course, there's Vista Points. I mean, Vista Points has a plethora of resources that are helpful, especially when one is needing to qualify for SSI and Medicaid, but then also want to preserve their assets.
That's terrific. Such a help. Well, do either of you have any parting thoughts or words of wisdom that you can impart on us today?
Well, Bart, I often say that caregiving is one of the hardest hats we wear. It's especially hard when we were caring for our own children and our parents at the same time. It's absolutely critical to make a plan long before the need arises and to have in place a power of attorney as well as an executor and a plan for who will be caring for your loved one if you are no longer able. Consider purchasing long-term care to help pay for services. And be sure to schedule time for self-care and rest as well. The other word of wisdom I can impart is to ask for help early in the process. I waited too long in asking for help, and it took me a year to regain my energy after caring for my husband.
Yeah, I'll shadow just what Genell says, and maybe some of the listeners can probably attest to this. Caregiving can be hard. I'm a business consultant also, and I tell a lot of my clients that if you fail to plan, you plan to fail. Well, you can take that into your personal life also. We work hard, we set up our legacy. We need to be intentional on that. We're here to make a difference in today's world, and so don't let lack of planning just take away the joy that you can have in your elderly years or if certain situations arise, because you never know what happens. Different things happen all the time, and so it's best to have a plan in place, and the best way to have a plan in place is to prepare.
Wow, you two have really opened my eyes. This is helpful and practical information. I know I better understand home health care now. I'm sure our listeners better understand it too. What are the best ways to contact you or home helpers of Germantown? Namely, that's your phone number, your email, your website.
Thanks for asking, Bart. You can reach us at 901-414-9696 or through the website.
Yeah, our quickest way, as Genell said, is through our main line at that number. You can visit our website at www.midsouthhomehelpers.com or come see us in person. We're at 5865 Ridgeway Center Parkway here in Memphis.
Thanks so much to both of you, Genell, Tim. You've truly provided information to each of us to understand and be able to take steps in home care if or when we need to. Thank you. This podcast has grown to reach more and more people and has become a beneficial resource for many. I encourage you to subscribe to the Vista Point YouTube channel. It's named VistaPoints SNT. That's SNT as in Special Needs Trust. This way you're notified as the latest episodes go live, which are on the 1st and the 15th of every month. You can listen to current and past episodes there. Again, the Vista Points YouTube channel is named Vista Points SNT. You can also find episodes to listen to or read their transcriptions on the Vista Points website at vistapoints.org. That's vistapoints.org. Enjoy your day with your loved one. Come back for more or look into past episodes of Choose Your Path. Regardless of where you find us, we walk beside you on your path. I look forward to sharing more information with you on how Special Needs Trust can be of benefit to anyone who's living with a disability. Cheers!